One.
Good afternoon and welcome to the Stop the Spread interview organized by the Rotary Club of the Faculty of Law, University of Colombo. My name is Vinuki Wedage, a second-year law undergraduate, and I'm joined with Dr. Lathika Athauda, a senior lecturer in public health at the Faculty of Medicine, University of California. She'll be sharing her insights and advices, helping you all to educate yourselves about the policies regarding COVID-19. We are so excited to have you join with us today for this Zoom interview, ma'am. And I'll be handing over to Farhat, a first-year law undergraduate, who'll be moderating the interview today. Over to you, Farhat.
Thank you. A very good afternoon. It's an extreme pleasure to have you here. Without further delay, let us dive into the questions.
Okay, thank you.
Do you think Sri Lanka has been successful in integrating scientific and medical analysis into policy making regarding COVID-19?
There is no short answer to that question, but COVID-19 is something that the whole world was suddenly hit, all in one go. And we had to kind of get together to make informed decisions in a vacuum where we didn't know what we were dealing with. And it was just, there was a lot of unknowns there. So as the disease evolved, Sri Lanka definitely had a panel of experts working on this and giving the policymakers the relevant advice on what should be done. And we were already also we had legal policies in place in order to tackle communicable diseases. Communicable diseases means a disease that can spread from one person to another. So we were rather equipped with all that. And to that, what we just had to do was integrate the scientific evidence. And I think we managed to do it. Success-wise, it's very difficult for me to say, yes, we were successful, because, it was a game where we had to learn on the go. So we were rather successful at times. We were very successful at times. And sometimes we just had to learn from our mistakes. But we definitely tried. And I think that's what was important. Just like everyone else all over the world, we also tried our best.
Thank you. Next, making vaccinations and face masks mandatory through legislation. Do you believe that this is a beneficial idea?
I do think so, yes. Because right at the beginning, in early February, March of 2020, where when we were just starting to hear about COVID and it was just announced as a global pandemic situation and mask rules were not in place. It was very difficult to get people to do that. But in some countries, I believe, where, there's a large group of people who are not very scientifically or medically aware of, how to protect themselves. In that kind of situation, it's really important, I think, where we make a blanket statement and say, look here, this is for your safety, you need to do this. Of course, we had, you would have also seen on the news and on, online, you would have read online where Americans made a huge fuss about masks and how it's their right. And in Sri Lanka, it was slightly different, I think, for multiple reasons. One thing is their health literacy. And also we just, we're used to following rules. From the small days, that's what we do. We look for guidance. And to our community, I think having that law, having it legislate, from coming through legislation is really helpful. Because if we left it to the people to choose, when they should wear and when they thought it was safe, it wouldn't have worked. So I think we came this far and we made it alive. Most of us, at least, is because we had that.
Yeah, that was profound. On a scale of 1 to 10, where do you think Sri Lanka stands in their response to the pandemic? Why do you assign that score?
Again, a very tough question. I can't give you a score. I can't give you a score because we were managing sometimes at one, how we had different peaks, right? Different waves. So we had the first wave coming in, somewhere around mid 2020s, and then another one towards the end of the year, and then 2021 was, that massive Delta wave, and then towards the end again we had the Omicron. So at different times we had different ways, the way it was micromanaged is different. And if you ask me to give a score, it's very difficult, because we all at the beginning were very careful, it was a really scary thing. You'd run a mile if you saw, even heard of someone with COVID, but we had to start living with it. And at some point we did have to leave, put our guards down a little bit, because we had to get on with life. So, and that meant some difficult decisions had to be made, for example, things like opening up schools, opening up the airport, like you could not function. And then you had to compromise certain things. So, and I think that we are not alone as a country in that. Lots of different countries had to do that. And I know you wanted me to talk a little bit about New Zealand as well. So I was personally in New Zealand when COVID hit. And I was there for a year. And even in response to the first question that you asked me about face masks, it was not made mandatory there. And people were given the choice. So people always chose not to and think, it wouldn't come to me. That was the mentality they had. And for the next question you're asking me about the scale also, then some people would say they managed really well, but what they managed to do was shut down everything and not allow anyone in. And it's so far away from the rest of the world. It's so easy to hide away. So you could rank them as, I don't know, right at the top and say, Sri Lanka didn't do so well, but we were relying on imports. We are relying, and we were kind enough to let our expats into the country when they were stranded without their jobs. So we had to do that, which means we had to take that risk. And I think given our health system and given the resources we had, financial and human, and given the level of understanding of our people, I think we did the best that we could. And that's what matters at the end of the day.
Yeah, very true. Next, the government of Sri Lanka had recently made a statement that wearing face masks in public was not mandatory. However, it was suspended within a couple of days. Why is there such an inconsistency in policymaking with regard to COVID-19? And what do you believe are the effects of it?
I think general policymaking has suffered, given the sort of unstable situation we're facing right now, today, April of 2022, that's when I'm saying this, so that it's documented. We've seen lots of policies, in and out, not just for health. So that's talks about some other issue that I'm neither knowledgeable or equipped to talk about. But with regards to health-related decisions, so we had the infectious control, the committee under the Minister of Health considering lifting the regulation for face masks, right? We had that discussion before New Year, actually. When I say we, I mean health sector. I'm not in that committee. So this was discussed. So it was not like a sudden decision that somebody made overnight. So it was on the cards. But then there was also, if you remember, 2021, soon after Sinhala New Year, we had suddenly a number of cases going up. So that was actually a point that was made. Maybe we should hold on to it until the the end of the new year, just so that people won't the mingling will kind of come down a bit. So those were all reasons that were considered. And the other reasons that were considered were, of course, the caseload is coming down, and we have to kind of learn to get on with it. And many other countries, especially in Europe, you probably know already that they lifted the masks regulation long before. And of course, they had other plans. They wanted people to kind of get exposed to this. And that was a different sort of agenda and plan that went on in that part of the world. We, on the other hand, we wanted to protect the people. We wanted people to be aware of this and be careful. So I wouldn't say that COVID is forgotten. I think it's become a part of our lives now, more or less. And if I don't know if you've seen it, but although the announcement was made that masks were not mandatory for public gatherings. People just, continued to wear it anyway. And now I think some people are a little confused as to if it's still applicable or not. It is applicable. And this inconsistency is not coming from the lack of knowledge or the lack of expertise. It's coming from a different place where all the other inconsistencies in policies are coming from. And I think my personal opinion is with regards to masks, if we go, our caseload keeps coming down and we don't get exposed to any new variants, we can actually relax this a bit, because I mean, we've been doing this for a long time. Of course, we also have to be careful as to where we are. I mean, if it's a really large gathering, then it can be made a personal decision. If you're going to a large indoor-outdoor gathering, and you can, if you're a vulnerable person, and if you feel like you're safer, people can always be given that choice. But at one point, we will need to lift this, and I think we are getting there, more or less.
Thank you. Moving on. What can Sri Lanka learn from countries like New Zealand about the handling of the pandemic? You already talked about it.
Yes, I did. So I think we can learn from them, and they can also learn from us. So I wish someone in New Zealand asked me this question as well, the other way around. But for us, if we are trying to learn from New Zealand, what they did was, one of the first things is, put your guards up right at the beginning. Take extreme caution, at the right time. And the level of commitment politically that New Zealand had to curbing the pandemic was, it was amazing. It was amazing how everyone was just so on board, and it was their primary focus. We, on the other hand, couldn't do that. Of course, we are a different country, different context, different problems. So it's difficult. But I felt like we didn't have that level of commitment, possibly due to the lack of understanding, possibly due to other problems that were, preventing, the other stakeholders from kind of getting on board. And of course, knowledge and health belief. At one point, I did say we have good health belief system, and people are very very good at following health related advice, especially. Whereas countries like New Zealand, people have their own opinions, and they would feel like doing something, and they might not sometimes agree with the government and the regulations that they set. They kind of have that going on, whereas we don't. So it's easy for us to have legislation and say, look here, this is what's going to happen to you. Just let's all do this together. It's easier to get our people to do that as opposed to them. But for us to learn as a community or as people, I think that's what we need to learn. We need to learn that when a problem like this comes, we all need to play our part. We all need to be, as individuals, careful, no matter what discomforts or inconveniences we have to face. We need to think about the other people and or the rest of us, because until everyone is safe, no one is safe, right? So that's something we can learn from them. And in terms of the health system and even policy making, the way they communicated their messages and their legal aspects of the legislation and the policies they put through for COVID was amazing. It was really amazing. They had like really unique systems. At one point in 2020, they had levels of lockdown, and they had like stage 4 is extreme lockdown. You can only step out of your house for this XYZ reasons, and very precise. You can have this many number of people in your house, and this is the kind of bubble you need to maintain. Everything was very well laid out. And also, now we also have this QR code thing going on here, for checking into places. Even they had that right at the beginning. And when they had it, one of the primary things that the people were worried about is privacy and your data, which the government and the system kind of ensured. You felt safe even if you recorded it. But even when I got back here and even to this day, I really don't feel that something about it. I think it's just our context, because we don't put it out there that your data is protected and that it's not going to go to the media or, everyone in the ministry, like wherever is going to read this, because that's difficult. When you have something like that, people are reluctant. So it's people need to change and our system needs to change. And with regards to communication again, so maybe their levels of lockdown didn't really work that well, because they have now changed it to a traffic light system. So they have a red, orange, green system now. And red is when everyone's full alert, and it's very clearly set in guidelines. This is what red means. So all the policymakers need to communicate is, look here, we are in red. And when New Zealand says red, from the small child, they know what it means. So it's really unique, it's really simple, and it's very well communicated, like from images to, the little videos, and their sort of education that they do about their policy is really good. And everyone is just on board. It's, when you're younger, you would have heard the stories of how when it's, when you're working together as a group, it's, you get things done faster and quicker and you're more efficient. And I've seen that over there, especially at the, higher level. So I think that's also something that we can learn. And as aspiring young people, undergraduates ready to take on the world, I think that's something we need to learn, especially when there's a problem and we are all in it together. We may be coming from different expertise, different communities, different whatever it is. If we need to tackle a problem that the country or our community is facing, we need to all get together and play to our strengths and just, work together for a common goal. That's something they tried to do, and I think they succeeded fairly well, and that's definitely something we can learn from them. Having said that, New Zealand really struggled with Omicron much worse than we did. I think that's because they had to open the country up, and nobody, basically this pandemic has hit every corner of the planet, and New Zealand couldn't escape it either. That's just how it is. But they did well in terms of their policy, and we can definitely learn from that.
Thank you. So finally, before we conclude, is there any final word you would like to leave us with?
COVID isn't really over. It's probably here to stay for a while longer. And what we know now, what we didn't know before, was that the virulence or the strength of the virus is slightly weakening. And that's because the virus is trying to survive, because if it starts killing its hosts, then the virus will die. The virus needs humans to survive, so it wants to stay. So it's kind of milder, it's sending us a milder version now, basically. But it'll be around. So I think good practice, we learned good things from COVID, right? We learned to wash our hands. We learned to, have respiratory etiquette, which was, amazing for a community like, Sri Lanka. We learned that. And the children who were born, or young children are starting to grow up with this, and that's become their normal, which is great, because this probably is not the last pandemic we will see in our lifetime. So we need to all remember the good things, and also some, unnecessary things that we had to change in our, personal lives, in our social lives. It's sometimes we can retain good things, and we should. And also try and go back to the things that we had good going on that we had to give up. I'm really intrigued. I'm really, I want to say this because I know this is going to be recorded and heard by young people. In our context, I'm sure you guys do this as well at uni. How you share your food, communal eating. It's a thing, and then it's such a difficult thing to ask our people to, not have that. And, this communal eating, it doesn't matter, when you're a group of friends, where you're coming from or who it has that sense of togetherness. And that's something I personally feel is one of the biggest losses that we had in a work environment, in a study environment, where we couldn't have that bonding and that togetherness. We had to intentionally stay away. So I hope we find some balance where we can still have those good things and also learn the other good things we learned during the pandemic and move forward. And finally, like I said before, just come together and work for a common goal. And, you know, do your best when you're being called to do it, irrespective of what your political beliefs and your cultural or religious beliefs are. Just do what's best for everyone, because we've been given that opportunity to do it, so we should. That's my message and last words.
Thank you very much, ma'am. Your words could.
Thank you.
And with that, back to you, Kiara.
Thank you so much, Farhad, and a huge thank you for Dr. Lathika Athauda for joining us this afternoon and for taking out time for this interview despite your busy schedule. Thank you for all your answers and for sharing your insights with us. We really appreciate it. And I think everyone can take something away from this wonderful and educative session. We would also be uploading a few articles under the Stop the Spread project on our official website, and we hope you all will find it useful and insightful as well. And that just takes us up to time. I'd like to say thank you on behalf of the team and the participants today, and make sure to like and subscribe our YouTube channel. Just a final thank you again for Dr. Lathika for sharing her insights, and I hope you all have a great week ahead.
Thank you.